This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2021. Physically active individuals, especially those engaging in jumping, pivoting, and cutting sports, are susceptible to anterior cruciate ligament or ACL injuries. These knee injuries can be treated with either ACL reconstruction or rehabilitation alone. However, the existing literature on the comparative outcomes of these treatment courses is sparse. A group of medical researchers sought to understand outcomes of the various treatments when patients presented with ACL injury. They devised a decision-making and treatment algorithm where a progressive neuromuscular and strength training preoperative rehabilitation program followed by guided shared decision-making about ACL reconstruction versus rehabilitation alone were important elements. The researchers used the algorithm for 276 patients from the Del-Oslo ACL Cohort study. After 5 years, the patients were categorized into 3 treatment groups and assessed for multiple clinical, functional, and physical activity outcomes. At 5 years, 64% had undergone early ACL reconstruction, 11% had undergone delayed ACL reconstruction, and 25% had had rehabilitation alone. The guided treatment choices that had been made by the participating patients differed by age, concomitant injuries, and predominantly Level 1 versus Level 2 pre-injury activity level. Interestingly, there were no significant differences among the treatment groups in terms of any of the outcomes. In fact, more than 95% of all patients were still active in some kind of sports. In addition, 65% to 88% of the patients had good scores above the threshold for a patient-acceptable symptom state on questionnaires designed to assess patient-reported knee function. Overall, the study showed that all 3 treatment courses for ACL were equally effective for allowing the patients to have good knee function at 5 years after ACL injury.